Hello, welcome to the Career Discovery podcast. On the show today, we'll be learning about our guests' area of expertise, their career journey, and what they wish they'd known when they were just starting out. Thanks so much for watching. We really hope you enjoy the show. Hello, Dan. Welcome to the show.
Hi, how are you?
I'm really good, thanks. How are you?
Not too bad, thank you.
Brilliant. Okay, well, do you want to just give us a short introduction into who you are and what you do?
Yep, sure. My name's Dan. I'm a registered nurse and I am a Tissue Viability Specialist Nurse is my role at the moment in an acute hospital.
Brilliant. And you work for the NHS, don't you?
I work for the NHS and I have done for started my training 20 years ago. Wow, that's impressive. Congratulations. Well, I can't wait till we have a deeper dive into that a bit later. But for now, I'm just curious, do you listen to podcasts? Yeah, I do. I've started walking to work quite a lot, so I like to listen to a podcast on the way to work.
Yeah? What's your favourite?
At the moment, I've been listening to it as a podcast called Chatterbix, which is kind of a comedy one with Joe Wilkinson in it. And there's Dan Snow's History Hits as well. I quite like. It's a bit more geeky, I suppose, but that's a bit of history and stories and things. So I quite like those. Bit of all sorts, really. But yeah, those are I'm listening to at the moment.
I know I've seen the second one, but I haven't seen the first one, so I'll have to check it out. That's the good thing about podcasts, isn't it? Though there's entertaining stuff, comedy, as well as informational podcasts as well. So excellent.
Definitely, a bit of everything.
Okay, all right, let's deep dive into your area of expertise, Dan. So before we get into the serious stuff, give us a sense of what your friends and family think you do all day.
Well, I'm a tissue viability nurse, which is basically a wound care specialist. So we look at different acute and wounds. So I guess my youngest daughter thinks it's fairly horrible and doesn't want to really know about any of it. And it's not really, because do is wounds and bits and pieces like that, so it's not for the squeamish sometimes. So my wife's never that keen to hear my stories, unfortunately. But people are aware I work in a hospital, and it's quite an interesting job. Nobody really knows the specialism. People don't really know what it means, so they're always quite interested in what it is. But I think we've got I'm the only nurse in my immediate family. I've got aunts and uncles, so people are aware of nursing and what we do. Yeah, so there's a bit of a broad awareness. Yeah, because then there's often misconceptions about what we all do, and I think that's why hopefully the audience are going to find this podcast valuable, because we are taking a deep dive to really uncover what these roles are, rather than just the versions we see in the movies or on TV. Definitely, no, it's an interesting.
Yeah. So if you were to with other guests, I'm asking them for an industry overview. But if you were to I guess, define nursing within the NHS, how would you kind of broadly define that?
In broad terms, I've been a registered general nurse for many years. In broad terms, I guess it's really trying to support people with their health choices. In an acute hospital, it's very much about trying to. I've worked in both acute and secondary care in community as well. So in the acute hospital, it's a very different mindset and a very different ethos. It's much more about trying to get people turn around very quickly, get them back to a good state of health, or as good as you can get, and then moving them back on into secondary care. Secondary care is very different, and I've experienced that for many years, and that's more about kind of rehabilitating and getting people to live their best sort of health lives in their own homes, really, trying to help them in that way. The acute is certainly a lot more fast-paced and a different type of working, really.
Yeah. And so how would you describe an acute hospital to somebody who doesn't know what that means?
Well, and I have mainly worked in the community most of my career, so I was myself, when I came into the acute, quite unaware of what it's a very strange sort of area sometimes. There's a lot of different specialisms. I think there's a lot of different departments. You've got surgical wards, medical wards that have very different ways of working and different structures. So working in a hospital, depending on what department you're in, it's all about kind of really patients, trying to see the patient through their journey from when they come into the acute hospital, whether that be through A&E or whether it be through an assessment unit or whether it's a direct referral into a surgical ward. and it's about trying to sort of map their journey, and there's lots of multiple people that all input within that. Myself and my specialism often have a place within that, but then you've also got health professionals such as allied health professionals, therapists, dietitians, the surgeons, the doctors, everyone getting involved to try and create the same goal, really, I guess.
Yeah, and just for the layman, does acute mean like short term or one off rather than a chronic long term condition, or am I misunderstanding that?
Yeah, so acute care, as we'd class it, would be the more pressing urgency. So if you came in and you had a chest infection, you had an appendix, a burst appendix, that would be an acute issue. Whereas more long-term chronic issues would be long-term conditions that somebody had, diabetes, for instance. So, but ticking along with it, they might need input, but it wouldn't necessarily be.
Yeah. Oh, thank you. That's really helpful. So I'm thinking of Addenbrooke's, for example, which is just up the road in Cambridge. Would they do a combination of both, or
But yeah, I mean, hospitals tend to be more acute, so people will come into hospital to have a specific, perhaps more urgent, pressing issue dealt with. You've got outpatient departments as well, so people will come into hospital for an outpatient, so they'll come to see them for just a visit, to visit a consultant, and that may be an ongoing problem that may span over years or a lifetime.
Yeah.
So it depends on what area you're in.
Yeah. And actually, I think that's highlights a really great point, doesn't it? I think sometimes when we think of a nurse, we think of one job, one set of skills, one set of activities. And, just by highlighting the differences between those two types of, hospital, acute hospital, and in the community, it just goes to show how many different versions of nurses there are and how many different, things they're touching on and types of conditions. So, thank you. Thanks very much. I understood in the end. So we've talked about the purpose of nursing broadly. So talk to us about the purpose of the Tissue Viability Specialist Nurse, and what do patients rely on you for in that role?
Well, so tissue viability is it's a growing role, I think, within hospitals and community. So predominantly we look after people's skin. So it would be wound care, pressure ulcers, could be surgical wounds, it could be chronic wounds such as leg ulcers. So as far as the patient's concerned, we're there to try and support them, to try and get these people back to a good state, really. So wounds, the thing about a wound, and we all probably have a limited understanding of wounds and cuts and grazes and things like that. A wound is there for a reason. So the wound is always a symptom of a problem. So whether that problem be circulatory, so whether there's blood flow problems going down to the legs, and that can sometimes cause ulcerations, and diabetes can cause issues with feet and foot care. They may have had a surgery and then had a complication following surgery. So there may be a surgical wound that needs to be managed. It can be pressure ulcers, and we see a lot of pressure ulcers. People are not moving, and they get areas which can be quite really nasty at sometimes. So a lot of what we do is trying to understand why they've got the wound there in the first place, and then try and support the patient with that wound care. Yeah. And the wound may be there for lots of other reasons, and some of those reasons we may or may not be able to deal with. Yeah. But that's what we're trying to support. Now, and what I always often find to the patient, I mean, for instance, a diabetic patient, the problem with their diabetic foot wound may be that their diabetes is poorly controlled. It may be that they're not managing certain aspects of their life very well. And that's the main issue. But to that patient, it's always going to be the wound, which is a very physical thing that they're having. They may have pain, and it may weep, and it may smell, and there may be all sorts of issues. Yeah. So I think a good part of my role is that actually you're supporting people with things that are important to them. And if you can make changes, it can have a drastic impact on their lives as well. So it's really quite rewarding, I think, sometimes.
Yeah, absolutely. And hopefully not only dealing with the wound, as you say, and getting that to a place of healing, understanding the root cause, and hopefully being able to have an impact there so they don't get repeat wounds, I'm guessing.
Yeah, and like with most things in healthcare and nursing and in general, it's about the impact that the patient makes on their own health is massive. And what lots of people do tend to do is to try to give that problem to someone else to deal with, if you see what I mean. So that's the doctor's going to give me a prescription for this and that will sort that out, or the nurse is going to sort this out for me. Actually, what we've got to do as nurses is to try and work with people that are in front of us and try and get them to come on board with that health. I think during COVID, particularly when there was lots of difficulties tapping into services and GP surgeries, for instance, I think what I certainly utilised a lot was getting patients to do their own dressings and their own wound care, which gave them a better results because taking more ownership of things and things were improving more quickly. I noticed. I still carry that on now because I think it's really essential.
Wow, that's really good, isn't it? Because I guess if it's more, if people have more ownership, like you say, they can really kind of be involved in that journey with you and learn to help themselves. Yeah, that's great.
Yeah, definitely. It's more about health promotion then, and then they can come away and perhaps not have these problems again, because these problems sometimes reoccur multiple times. But if the patient or the person takes on that role themselves, it's much more successful. And I think that's where nursing is shifting nowadays. It's a lot more about trying to get people to deal with their own issues rather than continually just trying to mop up problems. It's about trying to help promotion, really, isn't it?
Yeah, so like prevention as well as cure, not just cure.
Mm-hmm.
Yeah.
Definitely.
All right, thank you. So if we zoom in to an average Wednesday, what does your role involve? What activities are you doing on an average day?
We're our Tissue Viability Service is an integrated service, so we have specialist nurses who work in the hospital, and we also have nurses who work in nursing homes, and we also have nurses that work out in the community as well. So we're there to support advanced wound care. So basic wound care, so basic dressings and things like that should be managed on the wards, and it should be managed by general nurses and community nurses in the community. But if it's something that's quite complex, and some of these wounds can be very complex, or they need some input from us, then we would support them. So on an average day, we would look at dealing with referrals. So the wards in the acute, certainly in the hospital, the wards could refer, the doctors and nurses can refer patients to us with wound care issues, and then we can go and visit the patients on the wards, try and support them with the best way of managing this wound and what we need to do. We may follow that up again over days or a week, or we may leave that then on to the nurses to manage on the wards. We also deal with pressure ulcers, so we would look at what pressure ulcers may have occurred in the hospital and the community, and then we will go and check those and make sure everything's in place to try and stop that occurring or to try and improve that matter. We try to prevent all pressure ulcers, but pressure ulcers can occur because of immobility and when people become very poorly. Yeah. So it's very difficult. People will still develop pressure ulcers, so it's trying to ongoing sort of reasons and working to do that. We also run outpatient clinics. So on a Wednesday morning, we have a clinic where people can be referred into us, usually from GP surgery. So people are attending their GP practice and they want some help with some of their wound care. And then we also do a lot of teaching and training. So we'll teach new nurses. We'll come out on the wards and do some training and try and bring on practice and show nurses how we do how best practice should go, really. So yeah, it's a big amalgamation. So, but it will start in the morning with looking at our list, looking at our referrals that have come in, and seeing where we need to be and what we need to go and do first. Yeah.
Wow. And so what about those tasks that happen less frequently, perhaps on a cyclical basis or, just on an ad hoc basis?
Well, I mean, our job is very varied. I mean, wound care is quite a broad remit, really. I mean, it's everything from a burn to a leg ulcer to surgical wounds. So we may get asked to go into theatres occasionally to support the surgeons. They may be doing a complex piece of surgery that may need some equipment or wound care devices that may help. So we are often called upon to try and support them with that, and we sometimes go into theatres. So that's quite interesting. I mean, we get called down to outpatients. We may get called to accident emergency to the ED department. Yeah. So there may be somebody who's come in with traumatic wounds. They may have been in all injuries and bits and pieces like that. So we'd often get called out to see that as well. So you never quite know what you're going to get called upon. And we get called across all departments. So it may be children's services, maternity services, medicine, surgery, outpatients, ED, all across the whole spectrum. So you never quite know what a day is going to bring you, really.
Yeah, yeah. And if you had to think about your day in percentage terms, time with patients versus leading the team, because I know you lead the team, Dan, and then perhaps, I don't know, percentage of time spent on administrative work, because I'm guessing you have to document a lot of this. Like, what's the breakdown look like?
Well, that varies. It's become, the whole hospital's become incredibly busy, and all the specialist services take on the busyness. So when the wards and nurses are very busy on the ward, that will have a knock-on effect on the specialist services. So our services are called upon more and more to support with some of the bits and pieces we do. So my work at the moment is I do a lot. Although I lead the service in the hospital, there's a lot. I still take a large share of the clinical work. So I'll go out and see patients clinically quite. So that takes up most of my day if you're looking at percentage-wise. In between that, I have to manage a team. So I have my team that I manage, and I have to manage appraisals and all the kind of HR bits and pieces that may crop up and arise, sicknesses, absences, bits and pieces like that. And also then I have other kind of pressures from the board and from the higher execs of the hospital. So I have to write reports. I have to demonstrate what we're doing as a service to try and tackle many issues, whatever they may be. Look into incidents, complaints, problems across the hospital. So looking at, predominantly my work remains clinical, which is quite a nice job. But in between that, I'm also managing a team and answering to what I'm employed to do, really, isn't it? So we all have to prove our worth, I guess, in the environment.
And you mentioned that the department, the specialism, is growing. Is that because the hospital have decided that it's best to, funnel those cases into a specialism, or are wounds and pressure ulcers and so on just on the rise?
I think a bit of a combination, really. I think they're definitely. I think we've worked hard to prove as a department and become valuable as a department, so people see our work and see what we can do when you have a specialist input. Certainly, the hospital that I work in works on quite a specialist model, so they have a lot of different specialisms within the department. So the nurses have access to those specialist services, which is excellent for great care. We obviously can tap into a professional. I think it's taken away some of the generalism that we used to have as general nurses. So we're not always perhaps taking on some of the specialists being taken by people like myself, or teams like myself. I definitely think that that's the way that is, certainly in our hospital, that's the way it seems to be going. And I know that that's a similar theme in a lot of different hospitals. So there's that as well. And also I have seen in the last 5 years or so, wound care has definitely increased. I think during the pandemic and during COVID, there's been a lot of difficulty at accessing services, GP services and community services become very difficult sometimes. So that being patients are sometimes waiting longer to get care they need, or they're not actually actively seeking out the care that they should be having. So I think that we then get to them at a point which has gone a long way down the road, if you see what I mean. So it's a lot more complex to put them together again. I certainly think we are still seeing that from COVID and from the issues that we had with that. So we do see quite a lot.
Yeah. Oh, that's really fascinating. Thank you. So tell us what you enjoy most about your role. What do you love the most about your role or your work?
I think it is. I've always, wound care is a strange thing. I think if you speak to friends and family, you talk about wounds and dressings, that they all think it's a very sort of peculiar job, really. But I think in healthcare, and I've worked in healthcare for years and years, often when you're trying to support people with their health, some things never change, and you can't fix certain things because people's health is difficult and it's complex. I do think with wound care, you can make a difference. So if somebody's got leg ulcers, for instance, those leg ulcers will have massive effects on their life. The smell, the depression, recurrent infections, having to rule your life by going to appointments to have leg dressings and changes, whether you go to a practice nurse or whether you have the district nurse come to your house. They have a huge, huge impact, and the pain and the things they cause. So we've had lots of cases where we've had some really difficult, horrible wounds, really, that we've turned around and we've managed to support the person to get them healed or get them into a place where they are. So that's massively rewarding. And you meet some really interesting people along the way, which is really good. And that's why I probably why 20 years later I'm still enjoying my work and I still like it, because things every day is slightly different, because you're not just dealing with that the wound care or the nursing intervention you're doing. You're managing the person, and everyone that walks in and steps in, it's different. And I've had people that I've known for years, patients that I've known for many years, because their wounds are chronic and for various reasons. And you get to know people and you get to sort of work with them, and it's a really nice, very you're sort of very lucky to have that sort of role, I think, really, where you can feel you can make a difference. It's good.
Yeah. So it sounds like it's building relationships with these people and getting to know them over many years in some cases, but actually being able to have a positive impact on somebody's life. I can see why that would be, really, really enjoyable. Okay. What about the challenges? I'm sure there's some challenges. So what are the most challenging parts of your role or your work?
I mean, there's many challenges. I mean, everyone's aware, the pressures that the NHS are on, and that goes across the board. So it's people boards on the front lines of different assessment departments, to all the people working in specialist roles, and across the board, everyone in the administration and everything. The workload is a lot higher. There's a lot less people to manage the workload. So you see things. It's difficult because you see things that could be better if we had more resource and more people to be doing things. So I guess there's always that frustration. You're working with people, and you're often working with people at their lowest, because they're in pain or they're chronically ill or loved ones, and that's can be quite stressful and quite challenging, because you have to work ways of managing that and not being able to shut off at the end of the day, being able to go home and have a life as well, and not just be all consuming. So many frustrations and challenges. But I think, and you see a lot of nurses, you hear in the media and the news about lots of nurses leaving the workforce and that. But I've worked with many nurses who've been in the industry for many, many decades and many, many years. I think it's just remembering why we're doing it in the first place and what you get out of it. I always talk to people and students who come in and say, really, you need to. Healthcare is so challenging nowadays that you're never going to make everything right. You're never going to do everything you want to do. But you need to take away each end of each shift or end of each day something that you've achieved that you're proud of, or something that you think, that went well. As long as you can bring one of those home every day, I think you can still say you're making a difference, and that's how you manage it, really. But it's challenging at the moment. You watch people really struggling on the wards, particularly with low numbers of staff. But that kind of brings people together sometimes, I think.
Yeah. Actually, I think sometimes people do bond in a crisis, don't they? Well, I think often. And also, I think what you were saying about knowing your why, I think it's Simon Sinek who talks about that in his book. And he says, if you know your why, you can get through the toughest times, because you always go back to your why. Yeah.
No, it's very true. It's very true.
Yeah. So with your why in mind, maybe, looking back over your, 20-year nursing career, what's been your proudest moment?
Oh gosh, I've had so many good moments and things that I look back on. I think I was, as I say, I was a district nurse and a community nurse for many years, and I think that was all. When I came into nursing years ago, I never really knew that district nursing existed. I didn't know what it was at all. I presumed that a nurse would be working in a hospital, and that's what we did. And I didn't see anything other than that, because my family, who are nurses, have always worked in acute hospitals, so that's all I really knew. Surgical wards mainly. So I guess when I did my nurse training, it was exposed to the community, and I realised what it was. That was when I really loved it, and it suited me, and it kind of seemed good. So my ambition was always then to have my own team and be a district nurse, which is a manager of the areas, and to run my own team and be successful. So I guess, and over time and years, I got that my job, and then I had my own team. So I think I've always been very proud of that moment when I got my own team and I was managing a caseload, and it all seemed to be what I'd worked towards, really. Yeah. And then there's been many other things that we've done in my new job and my specialist job, and what we've built, and what we've gone from a very small department to a really large integrated team. So I think I'm very proud of that as well.
Yeah. Oh, well, with all the impact you're having, I can see why you're proud. You mentioned district nursing versus the acute hospital. And for those that are unsure, does that mean community-based nursing?
Yeah, so a district nurse is a community nurse. So
Okay.
we have, if you think about community staff, you have registered general nurses, and staff nurses will be staff nurses who are general trained. So community staff nurses will work in the community. So they'll do many of the tasks that you would do in the hospital, but they'll do it in the home setting. So they'll go to patients' own homes and look after them and give care to them. And then your general nurses will work in the hospital acute wards.
Okay.
The district nursing qualification is a manager, so they manage the care themselves.
Okay. Okay. So the main difference is district is based in the community, and then you've got your nurses that are based in a hospital. And I guess that gives people options, and there's different flexibility options available if you're in the hospital versus in the community, and so on.
Yes, definitely. Yeah, there's lots of different. That's one of the brilliant things about nursing, I think, is that there is so many different avenues, and you can start in one area and then move into another area.
Yeah.
A lot of hospital-based roles are now moving and sprawling out into the community, because that's where we realise is the best place to be. So lots of people who are working in the hospital are now going out and doing outreach and going out to patients' homes to provide services for them.
Yeah. Oh, nice. Nice that there's a mix and different options that might suit different people. And of course, to suit the patients, because it means that the patient doesn't always have to go into the hospital to receive their care. Okay.
Yeah, that's definitely the way.
All right. Well, thanks so much for taking us on that deep dive. So I'd like to go all the way back now, Dan, to talk about your journey from, education to where you are now. But before we get into the journey, just tell us, when you were a kid, what did you want to be when you grew up?
Well, as a kid, what I wanted to do was be an illustrator or a designer. I love Disney, and I wanted to be a Disney. So that's what I really wanted to do when I was a young child. So I was always interested in art and drawing, and that's something that I always wanted to do, and that's something I really enjoyed. But I used to watch Disney films when I was a kid, and I remember drawing them all out when I got back, and I wanted to go and work for Walt Disney Studios, and that was my dream.
And what sort of age were you when that was your dream?
Oh gosh, I don't probably in my, I don't know, 9 or 10 or 8. I would always drawing from a young age, so probably as long as I could hold a pencil, interested in that kind of thing.
Oh, that's amazing. And did you do art at school?
Yeah, I did art at school, and then I left. After school, I did a BTEC national diploma, so I did HND in graphic design. So that's where I'm aiming, really. I guess.
Yeah. Oh, wow. And I'm curious, when you were, having those ideas, who were you talking to about your career aspirations or ideas at that time?
I guess it was sort of friends and parents. My parents were a massive input. We didn't have. I do remember having careers advice at school, which is quite a few years ago now, but it was fairly vague. I think I don't think we had much input on that at that time. But yeah, mainly family and friends. When you do something like art, it's something that's quite. I guess you showcase it all the time, don't you, because you're doing it. So I was used to drawing, and then everyone would say, "Oh, that's really good, that's lovely." And at school, I was always getting drawing things for people because they liked what I did. So that kind of affirmates what you want to do, and that gives you that kind of encouragement, doesn't it? That you always might be something to do, really. But.
Yeah. So what happened?
Well, so I did my HND graphic design in the local college. And I think the main issue for me was when I was at school and drawing, you kind of like top of your peak, aren't you, really? And you're very good at what you do, and you're used to being like that. So the difficult thing I found when you went to college, especially something like in the arts, is that suddenly you're not the best anymore. There's lots of people who are either as good as you or better than you. So I think that takes difficult, and you change your way you look at it. So I enjoyed doing that, but it's quite a competitive market. And I guess I don't know what happened, really. I think I finished college, and I kind of drifted about a little bit for a few years. So I did different types of jobs, and I used to still do a bit of illustration, and I did children's murals and things on the side, and bits and pieces like that. But I then sort of I worked in a shop for a while where I finished college, and that was where I worked as part-time in a garden centre, as it were.
Yeah.
And then I did a bit of landscape gardening for a couple of years, worked self-employed doing that with another guy, and then I kind of drifted back in the shop, and then that's when I then found my nursing when I was a bit older.
Yeah. So what inspired you to, take that plunge into nursing?
Well, I was 23 when I did my training, and I got to a point. I was 23, and I didn't really know what I was going to want to do with my life, because I wasn't going to be the graphic design and the illustration wasn't sort of quite as I envisaged it would work out, and I didn't really know what to do. So I've got aunts and uncles who work in Essex, and they've been nurses for many years. So I've been brought up around nursing, and they were similar to me. They had a similar mindset and sense of humour, so it always sounded something that was quite interesting. I liked the way the stories they told were quite interesting. They talked about different colourful characters and the kind of things that go on in hospitals. So I thought, I'd always kind of thought this is perhaps something that I want to do.
Yeah.
So I decided to take the plunge. So I applied to a few local universities to do it, and I applied quite late in the summer. And to my surprise, I got the invites to the interviews a few months later, and there we go. So I did that. So I wasn't somebody. I wouldn't say that nursing was my life's vocation. I hadn't decided it as a young child. This is what I want to do, and then pursued it. I kind of drifted a little bit into it, I guess.
Yeah.
I speak to lots of nurses who are young. They were in they're sort of 18 or 19, 17 when they start their training, and they always seem to have that very fixed vision. This is what I wanted to do, and that's great. But that wasn't me particularly. I kind of drifted around a little bit before I found what I wanted.
Yeah. And when you started training, was that a full-time training course?
Yeah, it was a full-time training course through the university or campus then. So it was hard because you're 23 and you're earning money, and you've got a job, and you've had a flat at the time, and then suddenly you're working on a bursary, and you're having to change everything, all the aspects of your life really. It has to change. So it was difficult. It was a difficult 3 years, but it was we got through it, so it was good. I think when you're younger, when you start, if I started my training when I was 17 or 18, you haven't got quite as much baggage in a way, have you? So to change, I guess. So, but then you have life experience when you're a bit older. I guess it's both ways that have their different things. Yeah,
pros and cons, because I can imagine. Yeah, if you go to training straight after college, then you haven't had a taste of earning money, so you don't know what it's like to have had some money. So it's probably easier to adapt. But by the same token, if you're qualifying as a nurse at age 26, 27, I can imagine that having some life experience would make you a better nurse and to your patients, I can imagine.
I think so. I think because you've got to work with people. I think to be a nurse, the real trick of nursing, I think, because it is a people job, really. You have to get people to engage with you and to like you, maybe, if you want to use the term. But they have to invest in you enough to think, actually, this person knows what they're talking about, and they're going to help me. And if I try and let them support me, then I'll get a better outcome. So if you've got a bit of life experience, then that can go a long way, I think. So you can kind of empathise, and you've got more things to sort of connection to make with people. Although that being said, I work with students, and I've worked with lots of student nurses and doctors over many years, and I've worked with student nurses who are 18 and seem to have it all sussed out, and all the life experience, they really sussed out. And I've worked with mature students in their 40s who haven't got a clue what they're doing, and really, so I don't think it's all about life experience and age. I think it's different. I've worked with all sorts of different people.
Yeah, and actually you make a good point, because I think sometimes we think about nursing and patients. We often think about patients that are older, but of course there are children who need care. There are teenagers who need care. And so there's, I can imagine that, a teenager, for example, might be able to connect with a younger person, and so that might even go in that person's favour if they're going straight into their training after college.
Definitely. I feel like, yeah, I definitely think so. And yeah, patients, as you say, patients in the hospital on the whole do tend to be older because they tend to accumulate more problems that would bring them into it.
Yeah.
But that's not to be said that there's lots of young people, and I deal with people a lot younger than me, and across the whole spectrum every day. Every day I'll see somebody who's young. It's not just older people that we deal with. So
Yeah. So your training course, is it a mixture of theory and practice? How does that work out?
My nurse training.
Yeah.
Yeah, so the training for nurses keeps changing all the time. When I did it, it was very much a mixture between practice and theory. So you had to complete assignments and essays.
Yeah.
And then you also, that was about 50% of your credit, if you like, and then the other 50% would be practice. So you'd be wards or the departments, and you'd be signing off competencies and portfolios and completing that kind of thing. I think before my training, it was much theory based. And now it's gone a bit more practical based again now. So I think they've got a good mixture now. They seem to be doing a lot more portfolio based work on practice, and then they also do their assignments and essays and bits and pieces like that as well.
Yeah. Okay. So talk to us about your, leaving your nurse's training and then, the first job in Beyond.
Well, when I finished my training in 2005, and when you're a nurse, when you're a student nurse particularly, there's a lot, and there still is, I think, to a certain degree, a lot of pressure for you to go and work in a hospital. Yeah. So the kind of emphasis is you need to work in a hospital because that's where you'll get the experience, and you'll get that acute experience, and don't work in a hospital, you'll suffer down the line, and that's kind of the general feeling, and I don't think that's changed much in 20 years. But despite that, I decided, well, actually, I love the community, so I worked my last placements, several placements with a community team. I got on very well with the team. They were mainly older nurses near retirement, most of them were, and they were brilliant. And they had such a wealth of experience. And a job came up about the same time I was finishing, and the manager there, the district nurse, she got on well with me, and so I interviewed for the job, and I got the job. So I went straight into the community. So that was my first job in the community with this team. That were all great people, really really looked after me well. Yeah. So that was my first team. It was difficult in the community because you're on a ward. You're never alone. There's a wealth of staff there with you. You'll have doctors, nurses, therapists. There'll probably be at least 20 people roaming around you that you can call on at any time. So as a community nurse, you're very isolated in a way because you're on your own, because you tend to do most of your work alone, and you drive to the patient's house and you're on your own with them. And you never really know what you're going to walk into. So you might go into a house to take a blood sample, for instance, or to do a simple procedure, and you get there and the patient's unwell, or they may have, you may have all sorts of issues that you have to deal with. Find the person on the floor, or anything could happen. So that's where the experience comes in. So you're very, you are quite vulnerable in a way. Yeah. But it's quite a steep learning curve, I think. So that's quite difficult and challenging, but yeah, I loved it and I enjoyed it, and I stayed in the community for most of my career. After that, really, until And I'm guessing you worked your way up in the community into different roles. What's the kind of the structure of that pathway? Well, the communities, I think things have changed now from what they were. The community has always been, and probably still is a little bit. It's a bit harder to move up. There's not as many different levels of work. Yeah. In the hospital, there's a vast array, and there's so many different specialisms and different areas within that you can fall into. Community, certainly back then, there was really only a manager and a staff nurse, and that was the two areas really. So I really worked my way through doing as many different courses, and that's the benefit of healthcare, is that you have opportunity to learn. I don't think there's as much now as there used to be. I was a young nurse in the golden days when they used to throw lots of training at you, but but there's still opportunities for training, and I filled my CV with as many degree modules and diplomas and different courses and day courses and long courses as I could. So I did everything I possibly got thrown at me, including mentorship, so I could look after students and things like that. So I worked on that, and then eventually I did my district nurse diploma, which is a master's level certificate, and that means that you can then be a district nurse. So the district nurses are the kind of ward managers, if you like. So they manage the caseload. So the responsibility comes back to them, and they manage their teams. So you have community staff nurses and district nurses. So I then completed it was a 2-year part-time course, which I had to work away a lot of the time to do. And then you work through those competencies, complete your practice postgraduate diploma, and then you're a district nurse. And that's what I became then.
Yeah.
And then in the community, I then did a postgrad certificate in health education. So I became a practice teacher. So I did a university teaching qualification, really.
Oh, brilliant.
So then I trained staff to be district nurses. So I was training my own new run coming through as well. So that's where I was in my community, really. That's where I finished up.
Oh, that's fantastic. And what was behind the decision to move from the community to the hospital, which I guess, to your point earlier, you almost did in reverse. If some start out in the hospital and then go to the community. What was your decision behind your decision to go into the hospital?
Well, I'd never, all through my career, I would always been very community driven, and I never really liked hospitals. And whenever I went into a hospital to drop off or something, they always made me feel a bit uncomfortable because it was strange. When you're a district nurse and a community nurse, you become very used to working in the community environment. So you're used to working on your own. You're used to working in your own car and then going to patients' houses. So you become quite adaptable. And you will get used to working with people, really, in different social situations and things like that. So hospitals are very structured and stark. It's very much about doing things in certain different ways, and there's a different smell to them, a different way of working. Everyone's very busy and running around looking very busy. So I never thought that was somewhere I would go. But as a district nurse, wound care is something that we do a lot of, and it's kind of a bread and butter, really, of our work. So I've always had an interest in wounds and dressings, and much of the training that I've done has been based around wound care and that kind of thing. So a job came up in the hospital as a tissue viability specialist. So I think I decided that I'd done 15 years in the community, and I loved it still. Yeah. But I'd got to where I wanted to be, if you see what I mean. I got to be a district nurse, and I think after my role from that, I would, if I wanted to upgrade and go to a different band and to expand my career, I'd be moving further and further away from patients. So I'd be moving into kind of more strategic management roles. Yeah. Which I don't think I ever rule out completely, but at the time now, I don't think I'm ready for that. I would still like the clinical input, and I like working with patients. So this job seemed to have a good balance. So it was a bit about teaching, it was a bit about service leading, and it was a bit about, but it still had a very core of patient care. So I decided after all that time to come back into the acute, and where I started my training, and give it a try. So so it was a bit of a bold move, really, but it seemed to pay off. I've been doing it about 6 years now, so I love it. But that's how I ended up in this job. Ah, okay. Thank you. And earlier you were talking about how there seems to be a bit of a, almost a preference to start in the hospital and then go to the community. Is there a preference around starting as a generalist before you take on a specialism? I think, we have a lot of quite young in their career nurses who want to come into specialisms quite quickly. I speak to lots of student nurses who come out and spend time with us and other specialist nurses, and they say, well, you ask them what they want to do when they finish their training, where would they like to work. And a lot of them do say, I'd like to come and do your job, or I'd like to be a specialist nurse, or I'd like to do this. So they see the interest of it. It is an interesting, quite, it's a nice role to be in. But I think really you have to have that, at least some degree of general in your training. Because whether that be in community or whether it be in acute, I don't believe for a minute that you have to go and work in a hospital to be a nurse. I think you can go straight into the community opportunities. It's not any harm at all. But I think you do need a bit of general work, because you're working with, because everything's connected, isn't it? If you've got a wound, for instance, or if you're working as a diabetic specialist nurse, there's never that thing in isolation. You have to have a good broad understanding of what makes people work and what makes people not work. And And so if you haven't got a little bit of a general knowledge of how to manage people and manage different situations and manage different illnesses and the contraindications, then I think you might struggle a little bit. And the worry is that you may become a bit too. Because if you're looking at my own field, if I'm looking at somebody's I don't know, somebody's abdominal wound, if they've had a wound from surgery, I don't look at that first. I'll always look at why they got it. Why is it there, and what's happening to make them not happen? So what's happening with their health, or what's happening in their lifestyle that's stopping that happening? So I think that you get that with a bit of being around a little while and getting to work in different areas. So I'd always advise. I never advise people not to come into. They must come into the hospital. They must come into the community.
Yeah.
But I always advise people to get a little bit of understanding around you before you try and branch off into specialism.
Yeah.
You'll become quite in your career, really. I think if you're not careful.
Yeah, and I think that I can imagine it would almost limit your options down the line. If you start with a broad foundation, not only is that going to have potentially better outcomes for the patient, because you might spot something that otherwise you might not know about, but if you've got a broad base, you could go off in one specialism, but then perhaps decide, actually, I want to try a different direction. So I can imagine it's really, really beneficial.
I think so, and because I've been, my specialism is very specialist in a way. It's very niche. The wound care dressing care is quite a certain channel. But because I've had a longer career in the community, I've managed district nurses, I've managed people, I've also done teaching and training. I still have wide avenues ahead of me, so I could go off in different roles within the hospital or the community if I decided that's where I wanted to go in my career. So it's just given me a better background, really. So I'm not stuck in one position. I can then move on and use the skills I've gained, really, I guess.
Yeah. Oh, fantastic. Thank you. So as you look back on your journey, talk to us about the highs of that journey. What went well, what was relatively easy, what ran smoothly?
I think I've always gotten quite well. I've always been quite fixed on what I want to do, and I've always worked hard to achieve it. I think it's I think I don't think it's been a difficult 20 years. I think I've enjoyed it. There's been lots of challenges, but I've always sort of worked my way through. Yeah. I think it's as a male nurse as well. I think when you come into the profession as a male, it's different because there's still a very female-dominated environment. I think many nurses, but you do see a lot more male nurses coming into the field now. But they're still outnumbered by female nurses and lady nurses. Yeah. But I think that's something to adapt to and work with. I've never had any issues with the people I work with, and I've always enjoyed working with the teams. I think what's right always smoothly is I've always worked around good people. There's lots of really good people that you work with, and I think the team does make a big difference. And I've got to a point now in my career where I'm the lead the manager, and I've been able to use my team, get my team to where I want it to be. Yeah. And I've worked with I work now with people I've worked with years ago and people I've worked with in different jobs. So we kind of come back together to create something good, and I think that does help. It's great. It's a great job. I think the teamwork and working with people, when I look back on what I've done in the last 20 years, I always remember the people that have affected me along the way. That's really good.
Oh, great. Thank you. And what about looking back on those, again, thinking about that career journey, what would be the challenges you faced along the way?
I think coming into nursing's hard work, and I think the thing with it is it's not a job where you can get into your work and then just sit there. I think you have to there's a lot about keep moving, you have to keep learning. And I've got to a point in my career now where I don't perhaps have to do as much ongoing training. Yeah. But I still do training. I did a course in Bradford a year or so ago, and then I've done other modules, and you always have to take on new learning. So I think throughout my career I've done so many different modules and training things. It's tiring, and that will impact on your home life as well, because you have to do these things, and you can't get everything done at work. You have to take that kind of sacrifice and want to sort of achieve it. So I think you have to be motivated. Yeah. So I think at times when I'm trying to manage my day and my work, and then I'm also working a shift, then I've got to do a course, and I've got to finish an essay, and finish an assignment, and that it is tiring. You do sometimes think, oh, you should just try and get through it, but you always do get through it. But I think that's, and I think over the last, I think COVID was very challenging time, and I think that was a little bit. I think certainly at the beginning, I think there's a lot of unknown about what it was, and we were all quite nervous about it and working alongside it as we did, particularly in the hospital and the community. There was a lot of unknowns, so we had to make lots of decisions about what we wanted to do in our careers and where we wanted to go. And that was hard. And I think the first time in my career, and it's a little bit, you feel anxious about things. But you get over it and you get stronger for it. It's always good.
And if you think back to those challenges, and the most recent one being, COVID and the pandemic, what have you learned from those challenges?
I think it's I think we've just got to carry on, really. I think I've learned what we just carried on. So I think that you come together stronger as a team, and I think you have to work together and understand each other's fears and worries. And I think the best thing with nursing is if you work in a team, is you won't all be doing the same things at the same time, and certain people won't be doing as themselves in certain situations that you may be putting yourself into. But you have to, as long as you've got a broader understanding and a respect for each other, and that's not their time to do this or that time, I think that definitely helps. So I think we got through well as a team. Yeah. My wife's in healthcare as well, so we could work together as well, which made it more stressful in some ways and then less stressful in other ways. Yeah. But yeah, I think we just managed to get through it, really, and as we saw things carried on, we just carried on, really. Yeah.
And for you, what are the key things that make for a great team?
I think it's really important to surround yourself. I think it's just mutual respect is the most important thing. I think as long as you understand each other. Yeah. And like I say, I'm quite lucky now. I work with people that I have worked with for some years, and met some of the people I worked with years and years ago. So you have that already, that ingrained respect. I think there's several things that have to be worked as a team. I think you have to look after each other, but you also have to make sure you give the best service. I think the service that you provide has to come at the top. Your patients have to put their care has to go first, and then you have to look after each other. I think I've worked in teams where it's too much the other way, if you see what I mean. So either they're putting too much into the service and not worrying about each other, or they're looking after each other too, not worrying about the job in hand. So I think you have to find a good balance. I think when you find that balance, that works really well. But healthcare is a really good place, I think, for working as a team. It does bring you together. And things like COVID and things like patient cases that are really stressful and difficult, they make you stronger as a team. And I think that's quite unique to healthcare in some ways. I think we see things and deal with that you don't in other areas of industry. And I've worked in different jobs before. Yeah. It's never quite been the same as I do now. Yeah.
Oh, that's great. Thank you. So I guess looking back, if we're thinking about somebody who might want to find out more and go into, consider going into the profession, what are the essential or helpful educations or trainings to kind of get started?
I think, I believe now you need your GCSEs or as they're called at the moment. I'm getting a bit older now with all that, but you need your GCSEs. So I think when I was doing my GCSEs, and I've got a younger daughter who's doing hers at the moment, and you don't really see the point in them because at some points in your time, I think what they do is they give you a good grounding and a balance. And what a GCSE does do, whatever it is in, it will give you that gateway into a career or what you want to do. And I think my HND and my GCSEs in art and illustration have still stood me in good stead. So I think work hard on your GCSEs, and it's important. And I think maths and sciences, I think maths is important for nursing across all aspects. We have to do a lot of maths. I don't think you need to be a mathematical genius to be a nurse, but it does help. You need a good grounding in maths. So the subjects like sciences and maths are very useful. Yeah, gaining as much experience as you can, I think, is really important, and and working with people as much as you can. So looking at, we've got students coming into us at the moment who are doing their health and social courses in the college. So they're all about 17. So they're getting a really good grounding into that, in that nursing, and a good window into it. So they're getting at 17, they're getting exposure into a hospital, and they're working within my team, which is really good. And they're also working on general wards, and they're working with other specialists, and different therapists and physios and things like that. So that will give you a good eye opener, because I don't think everyone knows what healthcare is and what a nursing role is until you're in it. We might have a vision of what it might be. I think when I was doing training, I remember everybody I'd say I was a nurse, they're going to be a nurse, they would think I was washing people and that kind of thing. And that's what nursing was to most people. And very much caring for people like that is part of the role, but it's everything in between. So I think getting as much exposure is what I'd say when you're younger to it as you can, so you really know what's what and what you're getting yourself into, and it is something that you're going to like. I think I think there's lots of courses now in college, and I don't think you have to be so specific with your courses that you're doing. I don't think health and social care is really good. I think nursing is such a broad spectrum of work and career, really. I think you can do lots of things will fit into it and become quite useful depending what you do. So I think it's try and think about those. But maths and sciences are really important. I think I did okay in my GCSEs. I wouldn't say I was a A-star student in the slightest. I did a lot better when I was doing my training on the job. So my qualifications later in my career were much better and more impressive than ever they were when I was younger in my career. I got through, and I was average. So. But it's just work hard on those. I think is important.
Yeah, and I can tell why science would be important, because areas of the body and so on. And I have a feeling why maths is important. But could you just share a little more about that with us, please?
Yeah, well, maths. If you think about what general nurses do a lot, we work on lots of drug calculations. You're giving medications. You'll need to know about body weights. You'll need to know how to set up a drip, for instance, and you'll need to have a good, broad, average knowledge of maths to be doing those things. So working out a drug calculation, if you're setting up a syringe driver, which is a medication administration route, you have to work out what amount of drug you want to put in against what amount of saline or what water you're putting in with it. So they are really very real uses for it. Yeah. And also, as you get through your career, if you want to go into the management side of it, we have to write business cases. We have to write. We have to work out incidents and work out on equations and bits and pieces like that. So when I was younger, I never really saw the point in maths, but I use it every day. So I think having a rough you don't by any means need to be an A-star maths student to be a nurse, but just have a grasp of it, because it will become very useful, and you will need it when you go forward in your career.
Yeah, and managing those tight budgets, I'm sure.
Well, this is it. So I think that all of that comes in. Yeah, my job is you think of a nurse as somebody who's very much with people, but I also have to do a lot of paperwork, a lot of report writing, working out percentages, working out budgetary percentages, working out how much money I need to spend on this, or how much, if I want to have more staff nurses in my team, I need to give justification. I need to work out how much I want to spend and why they should give me the money, really. So really important.
Okay, so work hard on your GCSE, guys. and to qualify as a nurse, do you have to do a nursing degree, or like teaching, is there a conversion qualification people can do?
I think at the moment it's a degree in nursing. I think they do bursaries again. They took away a bursary a little while ago, which was fairly pointless exercise, but it didn't last very long. So I believe that the government's putting back the bursary. So that's really important to be able to support people, because it's a huge commitment. 3 years is a long time to come into a profession. So it's a huge commitment. So you need as much support as you can. I had to work part-time while I was doing it as well to try and support myself. Yeah. But so it's of course, but yeah.
Okay. All right, moving away from technical education and training, what personality, character traits or talents do you think are, make a good to have if this is something you think you might like to find out more about?
I think, like I say, despite all the technical stuff, and you can get we have lots of people going to research and some really, really intelligent people working in healthcare. They're amazing. But it is a people job at the end of the day. So I think you have to be able to talk to people and communicate with people and make relationships. Well, I think that's really important. So I think if you enjoy talking with people and working with people, I think that's a good start, really. I see lots of very good nurses, but they're very sort of, they don't communicate as well. So I think being good at communicating is really essential. I think the best nurses are the ones that can actually communicate and make people feel at ease. But you have to have a degree, all the other aspects as well. But I think it's a people job. I think you really have to be good with that.
Yeah, absolutely.
You're very. I do think you're exposed to lots of very sensitive information, and people will talk to you and confide in you and tell you their biggest worries and their fears. So I think you have to have a degree of good character for that. I think you have to be honest, and you have to sort of have a genuine sort of one. I think most people that I've worked with, on the whole, kind of care about other people, and they want people to do well. And I think that runs across the board. There's not many people in nursing. There's some strange characters you work with, of course, as there is in any job you work with. But on the whole, I think deep down people do care, and they show that in different ways. But I think that's important, to want to make a bit of a difference to people.
Yeah. Okay, so I'm hearing good communication skills, able to build relationships and connect with people. I'm guessing empathy, really important as well. You mentioned integrity, honesty and integrity, and being somebody who is a caring person. Yeah, you've got to want to help people, right?
Yeah, no, I think so. Yeah, I do think so. I think it's a job for that. But there's lots of. I think years ago when I trained, it used to be seen as more of a vocation. So you'd be nurses would be plucked from heaven, and that was what they were supposed to do, and that was where they were, and they did it because that was what they were meant to do, and they were kind of born to be a nurse. And I don't really agree with that. I've never agreed with that, and I think I've found it a very interesting career where you can go in so many different avenues and learn, and I think it's a really good place to grow and develop. Yeah. So I think that it's certainly you can learn to be a good nurse, and I think and I hope that I've become a better over the years, and I've learned how to be better around people and how to work with people. But as long as I think you have to have a little bit of a foundation of being able to talk to people, have a bit of a sense of humour, and be able to get on with people. I think is the first step. If you can do that, then you're on your way, really. I think.
Yeah. Okay. And not too squeamish. You mentioned earlier.
Yeah, not too squeamish, I guess, helps, because you will see all sorts of things. Although you will, you get used to all that.
Talk to us about the importance of role models, mentors, sponsors. How important have they been to you in your career?
I think they've got me through my career, really. I think when as I say, I've been lucky to work with some brilliant people, and I think even from my early days as a student nurse and as a newly qualified nurse, there were people I worked with back then 20 years ago I still think about today, and I still compare myself to them. And I've worked with people like that throughout my career, and you kind of think, well, is that how they would behave, or is that how I see myself against them? So I think that's great. I think leadership is what's really needed in the NHS, and I think in lots of jobs. But I think strong leaders, and I think the people that have been strong in my mind are the people that I sort of remember, and not necessarily the people that are. Leaders aren't necessarily the people who are managing you, if you see what I mean. They're not necessarily your line manager. It could be other people in the team that have experience, and just the best people. And I remember several nurses I work with, and everything's going wrong. The caseload's getting unmanageable. The referrals are piling in. The people are really poorly. Staff are going off sick. Yeah. And this particular person, or several people I can think of, would never seem phased. They'd never be stressed. Yeah. They'd sit down, they'd look at it, and they'd think, right, let's deal with this. They would never raise a sweat. They would be fantastic. And that's how I always hoped that I would be. I always wanted to be that manager that never seemed to be panicked or phased by anything. Yeah. So I think if you're like that, then everyone around is calm. Everyone deals with things and can deal with anything. But if you see managers and leaders that start to panic and crumble when it's stressful, and it is often very stressful as it is in lots of jobs, then that doesn't help. I think that makes everybody a lot worse. So I think strong, just somebody who's calm and collected is really important. And those are the people that I remember through my career, really.
Yeah, it's almost that constant, isn't it?
Yeah, you just feel relaxed, don't you? You just feel, that they feel like. I've often compared managers and people to Dumbo's magic feather. I've always said that nobody really needs them, but while they've got Dumbo's magic feather, they feel relaxed, and then they do their jobs really well. As soon as you take the feather away, then they suddenly crumble. So I think people rely on people, that calm, that steady calmness. And I think, well, actually, while so and so is on shift, I've had that when I've been a manager, and it's been people that have worked for me.
Yeah.
And I felt, well, actually, when so and so is on shift, I feel like everything's okay because I know they're going to be calm. I know they'll deal with what needs to be done. Yeah. And everything will work fine. No, they're not I'm their manager, so I shouldn't be. But that's what good people are. Good role models should be, I think.
Yeah. Oh, thank you very much. We've talked about kind of different routes and trajectories into the profession, but are there any other factors looking back that you think helped you, become the success you are?
I think it's just getting out there and taking on as much as you can. And I think I've always just grabbed every opportunity to do something different as I've ever done. Yeah. I've worked across various areas across the county, really where I live, and I know people quite well. And I always think if you connect, I've never been a great one for constant emails and things like that. I always like to talk to somebody. Yeah. Nowadays, it's very challenging to do that because you're working where you work with teams and you're doing lots of Zoom links and you're doing lots of emails. So there's ways around it. But I think if you want to get on, you need to make sure people know who you are. And the best way to do that is to pop down the corridor and speak to them. So don't always rely on people just to come to you, and go and speak to people and get them to know what you're about. So if you want to progress your career, I think you just need to get out there, really. And that's the same in any industry, really, isn't it? But things don't just fall on your lap. I think you have to work hard. I've always taken every opportunity to grow and keep moving and keep doing different things, and don't always stay in. I've always moved roles quite quickly. I always had a bit of a 3-year rule, so I changed my post within about 3 or 4 years, just to keep myself fresh. Because I think after a few years you become a little bit comfortable, don't you? I've been in my current role for about, I'd say, on a long time at the moment, and that's the longest I've been in a role. But yeah, I think you've got to keep moving, especially in your early career. Don't stand still. Don't be afraid to fight, to jump off and do something different, because you'll grow from it. You'll really learn.
Yeah, and it sounds as though I get the sense, Dan, that you're a lifelong learner and grabbing every opportunity to learn. And what's the saying? Kind of do or die. So, if you don't kind of take those learning opportunities, you would end up just getting a bit stale. So I think that's a really great example of that for us.
Definitely, yeah. And I think when you're in a career, when you're in a stressful job as well, it's easy just to come home and not have to think about it and just do your job and then move on. I think, and in some ways that's lovely, and we'd all like to do that. But I think in other ways you do miss out on a lot, because a lot of the things that I've got now is because I've done all these different things in the past. So pushing yourself to take on that opportunity, to do that extra bit of course, or to stay and do this, it doesn't have to be a long-winded thing, but just picking it as much as you can. You become a bit of a snowball, and you pick up things that roll down the hill. So I think the more you've got, and then you'll look back on your career, and it just gives you more opportunities. I think it really does. So. Yeah.
Compound learning, I call it. Okay.
Definitely. Yeah, that's good.
So looking forward, we've had the pandemic, COVID. We are reading about all of these, headlines with regards to nursing and so on. What for you does the future hold for nursing?
I think it's a very different role. I think there's a lot more up-and-coming roles now than there was. I think it used to be very hard and fast. There was nurses, there was doctors, and I think the future is a lot more about these kind of more generic roles, and there's lots of different roles where they're combining therapy, so they're combining physiotherapy and nurses, and a lot of leaders and managers who manage nursing teams are now working from social services or working from physiotherapy. So we never would have believed that years ago that would ever happen. So I think that's the kind of the future. I think, as we all know from watching the news or anything, that people aren't getting the population is sicker. We're living longer, so there's always going to be nursing. Will always be there in some shape or form.
Yeah,
I think I've experienced privatisation. I've experienced working in the private sector briefly in the community for a few years, and there was pluses and fours that. But I think the NHS will have to continue on under some shape or form.
Yeah.
But things will become very different. I think we need to concentrate a lot more on self-care.
Mm-hmm.
And like I've said, you can get people to do things for themselves and family members to support themselves a lot more than they do, I think.
Yeah.
We're looking at now in little virtual wards and doing more virtual stuff. So so your consultant will be at the end of a Teams call or a Zoom call, and actually you can talk to your consultant through that. And we've learned a lot about that in the pandemic as well, that actually bringing people in for outpatient appointments constantly is time consuming. It's not good for your patient. It's expensive. And actually we could do a lot more remotely through video calls and through phones, just as effective as working, as the old ways, but there's new ways of working. So I think there's a lot of that. I think we've learned a lot in the pandemic and the last couple of years. I think we've learned a lot, some good, some bad, but there's definitely some things will never change, I think.
Yeah. But hopefully continue to evolve and make kind of innovation gains where you can.
I think so, yeah, I definitely think so.
Yeah. Okay, so people who would like to, who are thinking, this sounds like a great career, I want to find out more. Firstly, what advice would you give that budding nurse? And secondly, where can they find out more?
Okay, well, I mean, there's lots of education. We have education teams in the hospitals. We've got staff that work solely with education. Mm-hmm. So I always I go back to always get yourself out there. So I think the hospitals are healthcare is such a well-populated population of people, isn't it? So most people know somebody who works in a hospital in some shape or form, whether they're a nurse, a doctor, or whatever they are. So talk to people and have it work, because it was the talking to my family that got me into it in the first place. So ask them what it really is like. Ask them what they like about it, what they don't like about it. I think the problem is if you read the media, you do tend to hear a lot of doom and gloom about people leaving the service, and there's a lot of disgruntlement about lots of other things. I wouldn't advise you to get too bogged down in that. I think you need to make your own decisions on things. And but speaking to people, talk to your local colleges and your schools about links into them. There's lots of I know that there's been lots of open days and things where they've had different careers, and NHS certainly trying to get in there. So talking to your local training teams in the hospitals will help. And college is probably a good place to start, because they'll have all those things to work with those people. But I think the more you kind of start talking to people and getting a real idea of what it's really like, don't be too biased by media or by anybody else. It's making your own decisions on it, I think, is really essential.
Yeah. All right. Thank you. So as we move towards wrapping up, Dan, what do you know now that you wish you'd known, when you were just starting out?
I don't know. I think I've been quite lucky, really. I think in 20 years, I don't. If you could say, would you have changed something in your career? I don't think I would have done. I love working in the hospital now, which I never thought I would. So maybe I would have got a little bit more. I don't think I would have gone straight to the hospital. I still would have stayed in the community, gone into the community. I wouldn't have changed a thing about how I did my career. But I wouldn't have been so afraid to embrace things about the hospital earlier on. So I would have opened my mind to ways of working. I guess that's the only thing I would say. But no, I don't. I think that everything worked out as it would, and I think I've done all that I thought I could do. But I think just be open. Perhaps I could have been more open to other ways of doing things and embraced more. I think through my career, I've always been quite insular. So I've looked after my team and my caseload, and I've never branched out to other areas and other locations and localities and sort of thought, well, this is how they're doing it. And so perhaps I would have looked at that more and networked more, I guess, which I did later in my career. Yeah. But in the earlier days, I stayed like that. But so I guess that's kind of what I'd say. Yeah.
Oh, what would you say to that kid who was drawing those Disney pictures and wanted to be an illustrator?
Well, I don't. Yeah, I mean, I still do a bit of illustration now, so I think when I was younger, a lot younger, it's one of the few. The joy of being younger like that and wanting to be an illustrator for Disney is that you chase your dreams, don't you? And anything's possible. And I see that in my daughter now, my younger daughter. Anything's possible. Whether you want to be a movie star or an illustrator or anything like this. And I think that's really important part of career and growing. I think because what that teaches you is actually you should chase things, and anything is possible, really. And it didn't quite work out for me, but I've kept that mindset throughout my career, and I've always chased things in hospital as a nurse of what I wanted to do, and I've got it. And I think you get it because you learn that. So I think if you want to be an illustrator or an animator for Disney, then you should try and be as best as you can to be the animator for Disney. Because if it's going to work, it's going to work, and it's going to be amazing. But there's always your career snakes and changes through time, and I think that always you might get surprised that you start on one tangent and then you end up moving off into something else completely. There's somebody else I worked on my college course who's now a nurse down the corridor from me as well, another specialist nurse. So,
really?
There must be something in it, but you never quite know what happens. So I don't. I'm glad I did my graphic design, and I'm glad I did all that, because those are all, like you say, they're lifelong skills. I still do bits and pieces now, and it's become less of a career, but more of more something that keeps me sane sometimes. So I think those early things, you should always chase what you want to be. I don't think you should stop. Don't be boring. Carry on doing it. I'm in total agreement.
You reminded me, one of my friends who I used to work with, she's American, and I sometimes think that the Americans receive that message perhaps more than the Brits do. Anything is possible. If you want it, you can have it, kind of thing. And I remember she told me she wanted to be the CEO of Disneyland, and I thought, wow. And when she was a kid, I thought, wow, I didn't know that was possible when I was younger. So hopefully this is going to help, the young people of today know that anything is possible, and you've just got to go for it.
Yeah, because somebody's going to be the CEO of Disneyland, aren't they? So it's got to be somebody. So somebody's got to chase that, and they'll get what they want. So, and you might not get exactly that, but you might get something very similar, or something you didn't even realise was as good. So I think that's important. Yeah, the Americans have got to on that in some ways, I think.
Yeah. Okay. So I would like to ask you, what is your favourite inspirational quote or expression?
Oh gosh. I don't know really. That's I don't know really.
Or what do you tell your daughter to motivate her or inspire her?
Well, it's like we go back to say it's just if you be passionate about what you do, love what you do, I think is a really good one. Really, I guess that's quite a good broad quote. But I think if you love what you do, then that's it. You're made up. You spend so much time in your work. You spend more time at work with your work colleagues than you probably do with your family. You see some of your family members. Yeah. So if you love what you do, then I think that you'll see the way, bad and good. And that's the same in anything. It's like relationships, isn't it?
Yeah.
It's not always good. It's sometimes rocky, but actually it works. And I think that's the same. So I try to tell people that look for what they love and love what they do. And I think that's a good one, really, in any career.
Okay. Thank you. Well, Dan, thank you so much for joining us on the podcast. I'm sure the audience are going to get so much value out of the conversation today. Any final words of encouragement for the audience before we go?
No, I think, because you're looking into careers in nursing, I think that, you should. It's a good career. I think there's a lot of negative media and negative influence about nursing and about healthcare. But I've been doing it 20 years, and I still go to work every day enjoying what I do. There's frustration. So I wake up. I don't ever wake up. I don't ever remember waking up thinking, "Oh God, I've got to work," or "This is going to happen." I think I always go in positive, and I always come back feeling positive. So I think, I think it's a good career. So I think if that's the field that interests you, then just throw yourself into it. I think it's still great, and we see some great. We've got lots of student nurses coming through all the time, and I still see some brilliant nurses that are going to be fantastic when they qualify. It's really reassuring to see the generation coming through, and they're still the same as we were when we were through. They're great, yeah. So it's really good.
Oh, all right. Thank you so much, Dan. Thank you very much. Thanks so much for joining us today. We really hope you enjoyed the show. If you gained any value out of today's episode, please help us spread the word by subscribing to the podcast. And if you have any questions, comments or suggestions, we would love your feedback. Please use the links in the show notes to get in touch. Thank you so much for watching. We'll see you next time.